Hello, everybody. Welcome to Find Out What's in Plintus Forest. So grab yourself a glass of water or a cup of tea and spend the next few minutes with me. Like I always say, don't believe everything you hear. Check your facts, do your own research. And what that means is, don't believe everything you hear because I might not be telling the entire truth. Don't you want to know what my butterflies are saying? They are talking. Don't you want to know what my butterflies are talking? I got news to share with you. And if you don't know it, now you're gonna. What's up, everybody? Man, I got some news. My butterflies are talking. And what are they saying? I got news. Well, everybody, as promised, this is the update show on the medical procedures. So, we're going to start off talking about the hand transplant, the penis transplant, and the uterus transplant. Those are the three, because 3 is a magic number. So I'll get to that in a second. But I want to say right off the bat, I actually received a couple of emails about the penis transplant and why was I even talking about that. I just want to say thank you to the person that sent me the email. I appreciate you being so tasteful and not sending me some stupid, ignorant email with a bunch of distasteful and disrespectful jokes about the penis. Because, men suffer just like women do. So I'm going to be serious about what I'm talking about here in the next few minutes because I don't think it's funny. There's erectile dysfunction. And if you are having trouble getting an erection, all you have to do, basically, is go to your doctor, get a prescription for, I don't know what it is. I think it's Cialis and maybe Viagra and a couple of other things that they have out there. But, I mean, your problem is not getting an erection. There's a pill for that. These men that I'm talking about don't even have a penis to get an erection, okay? These are men that have either had cancer or they're serving their country and they have suffered a traumatic pelvic area injury that has completely disabled them. So here you are, a young man, or maybe even an older man. Age isn't even a factor here. But you're serving your country. You have a beautiful wife, beautiful family. You want to come home after being stuck in Afghanistan or what have you for 2 or 3 years. You want to come home and make love to your wife. And now, Viagra's not the problem. The problem is you don't even have a penis to work with. That's devastating. That is something you can't even imagine something that devastating. And it's not funny. So I want to share with you some information that I have found out over the last couple of days. They say that the very first man to actually, in the United States, to have a penis transplant was actually Thomas Manning. But that wasn't entirely correct. Because the first man that actually had a successful penis transplant was a man that lived in China in 2005. But the reason why they're not claiming it as successful is because after 2 weeks, they had to remove it. Now, this is really strange, and I searched and searched, and I was not able to find any more information about this. So if you find out any more information, please send me an email, because I would like to know more details of what happened here. But apparently, he didn't reject it. That wasn't the issue. The issue was he suffered severe psychological problems trying to accept his new penis. It wasn't a rejection issue. And from what I read in the article, his wife even had psychological issues with the penis, which I find to be kind of strange, because it's not as if you wear your penis on your wrist like a watch, or it's on your face like a nose. You don't even see it. It's in your pants. You know what I mean? It's not like your hair, you know, or a wig or some dentures or what have you. So I can't imagine what kind of psychological issue it could have been. It seems like it would have been more of a psychological issue for him not having a penis and then having his penis back. But I mean, I don't know. And you know, when you've never been through something, which I don't want to go through that, but if you've never been through something, it's really hard to it's kind of hard to gauge what your reactions are going to be. But Professor Andre Vandermeer from Stellenbosch University, he has spent several years experimenting on cadavers. And if you don't know what a cadaver is a dead body. But he spent years experimenting on cadavers to see which nerves and blood vessels and other elements had to be joined to guarantee full function of the penis. Now, of course, the first gentleman that we talked about was Thomas Manning, and his penis had to be amputated in 2012 after he was diagnosed with pineal cancer. Now, of course, last I've heard, he's doing very well. I don't know if he's having intercourse yet. They said that was still months away, but he is using the bathroom just fine. Everything is just working out perfectly fine, fine for him. So there's actually been 3 men as of now in the entire world that have gotten a new penis for one reason or another, either cancer, being amputated, or just a traumatic injury in that area. Now, this is the really cool part. Now, check this out. After Thomas Manning had I believe it was Thomas Manning. I hope I'm saying his first name right. But after he had his penis transplant, there was talk about not only the erection and sexual activity, but if there would be live sperm. Well, that just remained up in the air. Check this out. A South African man, age 21, lost all but a 1 centimeter stump of his penis 4 years ago after a botched circumcision. Wait, 21, 2019, 17. So, okay, now this is just strange to me. So it says 4 years ago. So 4 years ago, he was 21. So my question is, okay, I understand he's in South Africa, which is different from Africa, but, why was he not circumcised by 17 anyway? Because usually, as a rule of thumb, when you're a baby, you're circumcised because, you get older, it's extremely painful. Not to mention, an uncircumcised penis, you have all that extra foreskin, and you have to learn how to clean your penis properly when you have all that foreskin, because you can get all kinds of lint and everything, and bacteria and disease gets trapped in there, which isn't good. So you have to learn how to properly clean and all that. So that's one of the reasons for the circumcision, but a lot of people are against that. But it says that the circumcision was botched. Now I'm thinking, how do you botch a circumcision? Okay, you have my thumb here, and it's a circle of extra fatty meat. All you have to do is take the scalpel, cut around it, and take that off. I'm not a doctor, but I'm not understanding how could you botch a circumcision. So anyway, the circumcision was botched, which left him with almost no penis at all. But he had a penis transplant, which was donated by a man that was declared brain dead. Now, Thomas Manning's penis was also donated by a man that was declared brain dead, which may or may not be a coincidence, but I think that's interesting. But anyway, after this young South African man went through his penis transplant, I gotta do this. Check this out. This is freaking amazing ass science. Okay, 5 weeks after his penis transplant, he was back to being sexually active. Okay, yes, he was. 9-hour surgery, 5 weeks later, this man is making love to his girlfriend. He had quality erections, he ejaculates, and has frequent sex. And check this out. She's pregnant. Yes, she is pregnant. So, this man has had a successful penis transplant, and now his woman is pregnant. That is a stinking miracle. And that just came out like 3 days ago. So I am sure it's probably going to be all over medical science news and the whole 9 yards, because let me tell you, that might sound really strange, but I keep saying it till I'm blue in the face. This is the era that we're moving into, people. We're just performing all kinds of miracles. And another thing too about the penis transplant, that's also, I think, kind of a milestone with the transgender community too, because with the transgender, when you go from being a man to a woman, and they remove your penis and give you a vagina, I think it's kind of easier because you just have to worry about the depth of the vagina, and then when you make love to a straight man, then it's just the depth of the vagina. But when you transition from a woman to a man, then there is always the issue with the penis and the size of the penis, how the penis works and things like that, because lots of men that have suffered pineal cancer and things like that haven't had to go to the extreme of having their penises amputated have to use what you call a pump. And they have to pump up the penis because it will no longer get erect on its own. So we are moving into all kinds of medical miracles. It's just unbelievable. So enough about the penis. Moving right along to the uterus transplant. We talked about that. And the uterus transplant, remember the first lady that had that done earlier this year? Her name was Lindsay. They didn't want to release her last name, and they just said that it was unsuccessful because there was complications, but they did not disclose what the complications were and why it failed. Well, what actually happened was she contracted a yeast infection, and that is what led to the failure of her uterus transplant. Now, it didn't say if she was going to try again or anything like that, but listen to this interesting fact. In August 9th of 2011 in Turkey, the first uterus transplant was actually done. Now, this was back in 2011. Now, they're not saying that it was a successful transplant simply because she has not given birth to any children yet, or had or carried a baby to full term, or had a child. But she has had normal monthly periods, and everything else is functioning just fine. So I don't know if she's not getting pregnant on purpose, or if she does not want to get pregnant. I don't know what the situation is there, because I wasn't able to find any more information, But in Sweden in 2014, a 36-year-old woman was born without a uterus, and she received a donated womb from a friend of hers in her 60s that had already had children. And now she's given birth to a healthy baby boy. Now, like I told you in the beginning, there's an option. Excuse me. Sorry. There is an option with this uterus transplant. You could leave it in and let it just disintegrate on its own, or you could put it in, get pregnant, have your baby, and then just simply remove it, which sounds a little weird, but that's also kind of cool. I mean, so if you think about it, if you've had to have a total hysterectomy, female problems or whatever, there is still hope for you to have a child. Keep on saying it. Miracles, nothing's impossible. Now listen at this. Where did it go? And also in 2012 in Sweden, the first mother-to-daughter womb transplant was done. Now, there hasn't been any more information on that I can find. Of course, I will keep you updated, but what a wonderful gift. You know, I mean, I don't have children, but if I did, and I had a healthy uterus, and my daughter was born without one, and she's longing to have a kid, I want grandkids, and I want my daughter to have a baby, so I use my uterus to have her. So what am I going to do? Now I'm going to give her my uterus so she can give me a grandchild. How cool is that? I mean, if you look at it that way. And last but not least, I'd like to talk to you a little bit about the hand transplant. Remember, excuse me, a couple episodes ago, the young gentleman that lost his hand in a meat grinder, and they just reattached that, and his nerves are like roots growing into a tree. I don't know what happened to that case. I looked all over the internet, and I couldn't find it anywhere. So if you guys found it, if you can find it, send me some information. I'd appreciate it. But in the meantime, the first person in the UK to get a double hand transplant says that he feels whole again, and he's looking forward to holding a bottle of beer. That's a man for you. Some women too. But Chris King is 57, and he lost both of his hands except his thumbs in a metal pressing machine at work 3 years ago. Now, he's become the second person to have a hand transplant at Leeds General Infirmary, and the first to have both hands replaced. 12-hour operation. Now, of course, he's going to need psychological therapy. Even though he had hands already, he is still going to have to learn how to reuse his new hands. And I saw the picture of it because when I saw the hand, I was thinking, here. Well, that's like your whole wrist. But they showed it, and however he was injured in this machine, it cut him right there. So all this is just missing. Now, it's funny how we always look at things differently. Now, here we have a man that lost his hands, and he's grateful because he just went through a hand transplant, and he's on the road to recovery. Now, listen to this story. Now, this is the real first American person that underwent a hand transplant 7 years ago. Now, this is Jeff Kepner's story. 7 years ago, he was the first, American to undergo the first hand transplant. But he says that he wishes he could have them removed. Those transplanted hands have never worked for him. Not one day, and they still don't work. He said that he can do absolutely nothing. But see, this is the sad part. When you're a doctor, scientist, surgeon, and you're getting into new discoveries, unfortunately, there is always an experiment. Always an experiment. And that's the process of practice makes perfect. No matter how you slice it. Yeah, it's ugly, but somebody is going to be a guinea pig. Somebody's going to be a guinea pig. And unfortunately, Jeff Kepner is one of many Americans who went who underwent experimental transplant surgery. But you know, things have skyrocketed in the past 7 years, so I'm sure that they could fix him now. I mean, they're having all this other success, but from what I read, he's refusing to have more surgery. You know, he doesn't want to be cut on anymore, sliced on anymore, anything, you know, or anything like that. You know, so I don't know. He has options, but you know, like I always say, you don't know what it's like to be in somebody else's shoes. So anyway, ladies and gentlemen, that is our show for today, my friends. You know, so you can follow me on Facebook, Instagram, and Twitter. Go to my website, buy my book, Angels Passing Through. I hope you enjoyed the show. Let's see. I think next episode we're going to be talking about, I think Elon Musk. Catch up with him, see what's going on. Tesla, see what's happening with him. I'm sure there's more news. And also the solar plane, trip around the world. And then see what's happening with the Zika virus. There's a couple of new mosquitoes that are out wreaking havoc. So I want to talk about that. Very, very, very interesting. And on that note, you guys, I am so very grateful for everything. And I am grateful for you too. Thank you for watching. God bless you all. And I will see you next time. We're going to get on out of here with my favorite tune. Have a great day, everybody. See ya.